September 15th, 1945. Sister Maria Hoffman had delivered babies in bombed-out bunkers, amputated limbs without anesthesia, and watched soldiers die for lack of simple bandages. But nothing in her 7 years as a German military nurse had prepared her for what she would witness on American soil. As the prison transport truck pulled up to the gleaming white building, she pressed her face against the barred window and whispered words that would haunt her forever. "This cannot be a hospital. This looks like a palace." But as the heavy doors swung open, Maria's disbelief deepened. Gleaming surgical instruments lined glass cabinets, more tools in a single room than her entire German field hospital had possessed. Nurses in pristine white uniforms moved between beds equipped with contraptions she had never seen before. "What is that machine?" she whispered to her fellow prisoner, pointing at a device monitoring a patient's heartbeat. The American guard overheard and chuckled. "That old thing? We're getting newer models next month." The 23 German nurses shuffled through corridors that gleamed under electric lighting so bright it hurt their eyes. Maria's worn boots squeaked against polished linoleum floors that reflected the ceiling lights like mirrors. In Germany, hospital floors were concrete, often stained with blood that wouldn't wash out due to soap shortages. Here, everything sparkled with an antiseptic cleanliness that seemed almost supernatural. Sister Ingrid Weber, walking beside Maria, reached out tentatively to touch a wall-mounted cabinet filled with medical supplies. Her fingers, permanently stained from years of reusing bloodied instruments, left smudges on the pristine glass. An American nurse noticed and simply smiled, wiping the marks away with a cloth before continuing her rounds. In any German hospital, touching valuable supplies would have resulted in severe punishment. The abundance was overwhelming. Rows of hospital beds stretched in perfect formation, each equipped with crisp white linens that looked freshly laundered. Maria calculated quickly. There were more beds in this single ward than in the entire medical facility she had managed in Munich. Yet these beds weren't cramped together like sardines. Each patient had space, privacy, dignity. The concept felt foreign after years of treating 3 soldiers in spaces meant for one. As they moved deeper into the facility, Maria noticed details that made her question reality itself. Waste baskets overflowed with discarded packaging from medical supplies. In Germany, they would have carefully saved every piece of paper, every metal clip, every rubber stopper for potential reuse. Here, Americans threw away materials that would have been treasures in any German medical facility. The sounds were different, too. Instead of the groans of untreated pain that had become background noise in German hospitals, she heard quiet conversations, occasional laughter, and the gentle hum of machinery she couldn't identify. Patients appeared comfortable, some even reading magazines or listening to radio programs. In Germany, patients were grateful simply to have a place to die with minimal suffering. An American doctor approached their group, his white coat unstained and perfectly pressed. Maria instinctively straightened her posture, expecting harsh interrogation or cruel treatment. Instead, he spoke in careful German, his tone professional but kind. "Welcome to Walter Reed Army Medical Center. You'll be working alongside our staff to care for wounded personnel of all nationalities." The phrase, "all nationalities," struck Maria like a physical blow. In German military hospitals, treatment priority was determined by rank, race, and political value. The idea of providing equal care regardless of nationality was revolutionary, almost treasonous by the standards she had lived under for years. As evening approached and the German nurses were assigned temporary quarters, Maria lay on a narrow but clean cot and stared at the ceiling. Through the window, she could see the hospital's main building illuminated against the dark sky. Every window glowed with steady electric light, no flickering candles or oil lamps like in Germany. Even at night, this American hospital maintained an appearance of abundance and reliability that seemed impossible. Sleep came slowly, interrupted by the memory of that American nurse wiping her fingerprints from the glass cabinet with casual indifference to the damage. In Germany, such supplies were guarded like state secrets. Here, they were apparently so common that smudges on display cases were merely minor inconveniences. But the most disturbing realization was yet to come. Tomorrow, Maria would begin working in this palace of medicine, and she would discover that what she had seen today was merely the surface of America's medical abundance. Dawn broke over Walter Reed with the kind of clarity that seemed impossible to Maria's war-weary eyes. German hospitals had operated in perpetual dimness, conserving electricity and hiding from Allied bombers. But here, fluorescent lights hummed to life throughout the building, banishing every shadow with an intensity that made her squint. As she entered the main surgical wing for her first day of supervised duty, Maria discovered that yesterday's glimpse had revealed nothing compared to the medical wonderland that awaited her. The supply rooms defied every assumption she had formed about medical scarcity. An American nurse named Lieutenant Sarah Chen unlocked cabinet after cabinet, each one revealing treasures that would have equipped an entire German field hospital. Boxes of sterile syringes sat stacked to the ceiling, hundreds of them gleaming in individual paper wrappers. Maria's hands trembled as she calculated the impossible mathematics of abundance. In Germany, a single syringe served dozens of patients until the needle became too dull to penetrate skin. Lieutenant Chen noticed Maria's fixation and pulled out a fresh syringe, demonstrating its use on a practice pad. "We use these once and dispose of them," she explained matter-of-factly. "Infection control, you understand." The casual mention of infection control as a standard practice rather than an impossible luxury made Maria's knees weak. She had watched gangrene consume entire wards because they lacked basic sterilization supplies. But the syringes were only the beginning. Chen opened another cabinet revealing surgical instruments that gleamed like jewelry under the harsh lights. Scalpels, forceps, clamps, and retractors lay arranged in precise rows, each one sharper and more refined than anything Maria had ever held. She reached out instinctively to touch a surgical clamp, its chrome surface reflecting her stunned expression. "These are beautiful," she whispered in broken English. The American nurse smiled and handed Maria the clamp to examine. "The old batch," Chen said apologetically. "We're expecting a shipment of improved models next week. Better spring tension and longer handles." Maria nearly dropped the instrument. In Germany, such a clamp would have been the prized possession of a chief surgeon, carefully maintained and used for years. Here, it was considered outdated equipment awaiting replacement. Moving through the surgical suite, Maria encountered machines that seemed pulled from science fiction. Heart monitors displayed rhythmic lines on glowing screens, their electronic beeps providing constant updates on patient vitals. X-ray machines sat in dedicated rooms, ready for immediate use, rather than being shared between multiple hospitals. Anesthesia equipment that regulated breathing and monitored consciousness automatically replaced the crude masks and manual ventilation she was accustomed to. Lieutenant Chen demonstrated each machine with practiced ease, explaining their functions as if they were common household appliances. "This monitors blood pressure continuously," she said, adjusting dials on a device the size of a small refrigerator. "And this one tracks temperature, pulse, and respiratory rate simultaneously." Maria stared at readouts displaying precise measurements the German doctors could only estimate through experience and intuition. The pharmaceutical supplies bordered on the surreal. Entire walls lined with medications that had been mythical rarities in German hospitals. Morphine sulfate filled multiple shelves, each vial clearly labeled with dosages and expiration dates. Maria had learned to stretch single doses of pain medication between multiple patients, watching men bite wooden sticks to endure agony that could have been easily relieved. Here, individual patients received full therapeutic doses without rationing or compromise. Antibiotics occupied their own climate-controlled storage area, with penicillin supplies that exceeded Germany's entire wartime production. Maria remembered the desperate attempts to cultivate mold in laboratory conditions, hoping to produce crude versions of the miracle drug. American hospitals maintained refrigerated inventories of refined antibiotics as if they were common groceries. But perhaps most shocking was the casual attitude toward medical waste. An American doctor finished examining a patient and disposed of his gloves, stethoscope covers, and examination materials in a single bin. Maria watched in horror as supplies equivalent to a week's inventory in German hospitals disappeared into the garbage. When she instinctively moved to retrieve the discarded items, Lieutenant Chen gently stopped her. "Those are contaminated now," she explained. "We replace them fresh for every patient." The concept of single-use medical supplies contradicted everything Maria understood about resource management. In Germany, they had boiled and reused surgical gloves until they cracked, repaired stethoscopes with tape and wire, and sharpened scalpels on whetstones until the blades became too thin to hold an edge. The American practice of discarding perfectly functional equipment after one use seemed criminally wasteful, yet medically superior. As her first shift progressed, Maria realized that abundance wasn't merely about having more supplies. It enabled entirely different approaches to patient care. American doctors could order multiple tests without considering cost, prescribe optimal medications without rationing concerns, and maintain sterile environments without compromise. The luxury of unlimited resources allowed them to practice medicine as it was meant to be practiced rather than surviving with desperate improvisation. The third day brought Maria face to face with waste that cut deeper than any scalpel she had ever wielded. During morning rounds, she witnessed an American nurse named Lieutenant Patricia Mills finishing a dressing change on a minor wound. The bandage she removed was barely stained, cleaner than most of the fresh supplies Maria had worked with throughout the war. Mills crumpled it without hesitation and tossed it into a metal waste bin that already overflowed with similar discards. Maria's breath caught in her throat. That single bandage could have treated 3 separate wounds in any German field hospital. She had spent countless hours carefully unrolling used bandages, washing them in cold water with harsh soap when available, and hanging them to dry for reuse. The bloodstains never fully disappeared, creating permanent brown maps of previous injuries, but they remained functional. Watching Mills reach for a fresh bandage from an apparently limitless supply felt like witnessing a form of medical blasphemy. Sister Ingrid Weber stood beside Maria, her face pale with recognition of the same impossible waste. In whispered German, she recounted the night she had torn strips from her own undergarments to bandage a dying soldier's wounds. "I used my slip, my stockings, even threads pulled from my uniform," she murmured, "and here they throw away bandages that could have saved him." Her voice cracked with a mixture of grief and rage that had been building since their arrival. The systematic disposal of medical supplies became a daily torture for the German nurses. They watched American staff discard surgical gloves after single uses, throw away gauze pads with minimal staining, and replace IV tubing that appeared perfectly functional. Each discarded item triggered memories of desperate improvisation, using newspapers as bandages, fashioning tourniquets from bootlaces, performing surgery with instruments sterilized over candle flames. Maria began secretly collecting waste during her shifts, hiding items in her uniform pockets that American nurses had discarded. Rubber gloves with tiny pinpricks, gauze pads with minor discoloration, syringes with slightly bent needles, all treasures by German standards, all garbage by American measures. She planned to demonstrate how these items could be salvaged, repaired, and reused, but Lieutenant Chen discovered her cache during a routine inspection. Instead of anger or suspicion, Chen's expression softened with understanding. "You were saving these because they're still usable in Germany," she said gently. Maria nodded, unable to speak past the lump forming in her throat. Chen examined each item Maria had collected, her clinical eye assessing their potential utility. "In your position, I would have done the same thing," she admitted, "but here the risk of infection from reused materials outweighs the cost of replacement." The revelation that Americans could afford to prioritize safety over economy struck Maria as both admirable and infuriating. German medical doctrine had emphasized conservation above all else, forcing medical personnel to accept higher infection rates and compromised outcomes in service of resource preservation. American doctrine apparently considered human life valuable enough to justify disposing of potentially functional equipment rather than risk patient safety. This philosophy extended beyond individual supplies to entire systems. Maria discovered that American hospitals maintained backup inventories for their backup inventories. Emergency supply caches contained enough materials to operate independently for weeks, while German hospitals had struggled to maintain day-to-day operations. The American approach eliminated the desperate calculations that had consumed Maria's daily routine, deciding which patients deserved fresh bandages versus reused ones, or which injuries warranted precious morphine doses. The psychological impact of witnessing such waste began affecting all the German nurses. They developed unconscious habits of flinching when American staff discarded supplies or instinctively reaching toward waste bins to retrieve items that might still serve some purpose. These behaviors marked them as foreigners more clearly than their accents or unfamiliarity with equipment. American nurses learned to recognize the telltale signs of German nursing trauma: the hoarding instincts, the careful rationing of personal supplies, and the inability to waste anything with potential medical value. Lieutenant Mills took special interest in helping Maria adapt to American medical practices. She demonstrated the reasoning behind single-use protocols, explaining how cross-contamination between patients had been virtually eliminated through disposable supplies. "Before the war, we reused equipment too," Mills admitted. But mass production and improved logistics allowed us to prioritize patient outcomes over cost savings. The economic foundation of American medical waste gradually became clear to Maria. The United States had developed industrial capacity that could produce medical supplies faster than hospitals could consume them. German industry had been focused on military hardware, leaving medical facilities to compete with ammunition factories for basic materials. American factories manufactured bandages, syringes, and surgical instruments as efficiently as they produced tanks and aircraft. Yet understanding the logic behind American medical practices didn't ease the emotional pain of watching waste. Maria continued to struggle with the sight of discarded supplies that could have saved lives in German hospitals. The abundance that enabled superior patient care also represented a cruel reminder of the resources that had been denied to her patients throughout the war. Every bandage in an American waste bin symbolized a German soldier who had died from infected wounds that could have been prevented with proper supplies. The irony wasn't lost on any of the German nurses. They had been taught that American capitalism was wasteful and decadent, while German efficiency represented superior resource management. Now they witnessed firsthand how American waste produced better medical outcomes than German efficiency ever had. The propaganda had inverted reality, presenting scarcity as virtue while abundance delivered actual results. The morning of September 22nd shattered Maria's understanding of warfare itself. She had been assigned to the post-operative recovery ward, expecting to care for wounded American soldiers returning from Pacific battles. What she found instead violated every principle of military medicine she had been taught throughout 7 years of Nazi indoctrination. In bed after bed, German prisoners of war lay recovering from surgeries performed with the same skill, equipment, and attention given to their American counterparts. A young Wehrmacht soldier named Klaus Miller occupied the bed nearest to the ward entrance, his leg elevated in a complex traction system that Maria recognized as state-of-the-art orthopedic equipment. Beside him lay an American Marine who had lost his arm to a Japanese grenade on Iwo Jima. Both patients received identical pain medications, identical wound care, and identical attention from nursing staff. The sight paralyzed Maria with cognitive dissonance, so severe she gripped the doorframe to remain upright. Lieutenant Chen noticed Maria's frozen posture and approached with characteristic gentleness. "The Geneva Convention requires equal treatment of wounded prisoners," she explained, as if this were the most natural thing in the world. "Our doctors take that obligation very seriously." The casual mention of international law as guiding medical practice stunned Maria. German military hospitals had operated under entirely different principles, treatment priority determined by race, rank, and political value rather than medical need. Maria approached Klaus Muller's bedside, her nursing instincts overriding her shock. The young soldier's eyes widened with recognition at her German accent, and tears began streaming down his face. "Sister," he whispered, "they gave me morphine before the surgery. Real morphine." I felt nothing. His voice carried wonder rather than gratitude, as if he were describing a miracle rather than standard medical practice. Maria's throat constricted as she remembered the screams of German soldiers undergoing amputations without adequate anesthesia. The American Marine in the adjacent bed overheard their conversation and turned his head toward them. Maria tensed, expecting hostility or demands for preferential treatment. Instead, the young man smiled weakly and said, "Your English is pretty good, nurse. Klaus here's been teaching me some German words." The casual friendship between former enemies, facilitated by equal medical care, challenged everything Maria had been taught about the fundamental differences between races and nationalities. Dr. Robert Steinberg, the orthopedic surgeon responsible for both patients, arrived for morning rounds. His matter-of-fact approach to treating German and American wounded equally revealed the depth of American commitment to medical ethics. He examined Klaus Muller's surgical site with the same thoroughness he applied to the Marine's amputation, adjusting medications and monitoring healing progress without regard to nationality or former allegiance. When Maria asked Dr. Steinberg about his treatment philosophy, his answer carried weight that would haunt her for decades. "Medicine recognizes no flags or uniforms," he said simply. "A fractured femur requires the same treatment whether it belongs to a German, American, or Japanese soldier. Pain feels identical regardless of the language used to express it." The revolutionary concept that human suffering transcended political boundaries contradicted the racial hierarchies that had governed German medical practice. Maria discovered that equal treatment extended beyond immediate medical care to rehabilitation services, psychological support, and long-term recovery planning. German prisoners received physical therapy using the same equipment and techniques provided to American patients. They participated in occupational therapy programs designed to restore function and independence. Some even received prosthetic limbs, crafted by the same technicians who served wounded American veterans. The integration of German prisoners into American medical routines created daily scenes that would have been unthinkable in German hospitals. Former enemies shared meals, played cards during recovery periods, and assisted each other with basic activities. American nurses taught German patients English medical terminology while learning German phrases in return. The boundaries between captor and prisoner dissolved within the healing environment of shared medical care. Sister Ingrid Weber worked in the adjacent surgical ward, where she witnessed German prisoners receiving blood transfusions from volunteer American donors. The sight of American blood flowing into German veins represented a level of humanitarian commitment that contradicted every propaganda message about Allied brutality and racial superiority. Ingrid later confessed that she had expected American medical staff to allow German prisoners to suffer or die as punishment for their nation's crimes. But perhaps most shocking was the discovery that German medical knowledge was valued and incorporated into American practice. Dr. Steinberg regularly consulted with captured German physicians about surgical techniques and treatment protocols developed on the Eastern Front. The collaborative exchange of medical expertise between former enemies demonstrated that American confidence extended to learning from their prisoners rather than dismissing their contributions. The psychological impact on German prisoners receiving equal medical care was profound and lasting. Many developed fierce loyalty to individual American medical staff members who had saved their lives or restored their function. Others experienced guilt over receiving better treatment as prisoners than they had provided to their own patients during the war. The moral complexity of accepting superior care from former enemies created internal conflicts that would persist long after physical wounds healed. Maria began to understand that equal medical treatment served purposes beyond humanitarian obligation. It demonstrated American values more effectively than any propaganda campaign, proving that democratic principles could be maintained even toward enemies. The policy created living testimonies to American character that would return to Germany with powerful stories of unexpected mercy and professional excellence. The contrast with German medical practice became impossible to ignore. Maria had witnessed Wehrmacht doctors denying medical care to captured Soviet soldiers, allowing them to die from treatable injuries. She had participated in medical experiments that prioritized research over patient welfare. The American approach to prisoner medical care exposed the moral bankruptcy of the system she had served, creating shame that would follow her for the rest of her life. The revelation of true abundance came not through grand gestures, but through the endless accumulation of impossible luxuries. Maria's fourth week at Walter Reed brought her face to face with resources so plentiful that American medical staff treated them as mundane necessities rather than precious commodities. The pharmacy alone contained more morphine sulfate than the entire German military medical corps had possessed at any point during the war. Yet American nurses administered full therapeutic doses to patients suffering from minor post-operative discomfort. Lieutenant Mills handed Maria a small glass vial containing enough morphine to ease the suffering of a dozen German soldiers. "Standard post-surgical protocol," she explained casually. "We'll administer this every 4 hours until his pain subsides." The mathematical impossibility of such generosity made Maria's hands shake as she prepared the injection. In German field hospitals, morphine had been reserved for the most extreme cases, soldiers facing amputation without anesthesia, or dying men whose screams disrupted entire wards. But morphine was merely one element in an ecosystem of abundance that defied German comprehension. The hospital's electrical systems provided unlimited power for equipment that German hospitals had never possessed. X-ray machines operated continuously throughout the day, producing detailed images that revealed injuries invisible to physical examination. In Germany, X-ray film had been so scarce that doctors relied on clinical judgment and hope when treating internal trauma. Maria discovered that Walter Reed maintained its own power generation facility, ensuring uninterrupted electricity even during thunderstorms or equipment failures. The concept of backup power for medical facilities seemed almost decadent to someone who had performed surgery by candlelight and operated ventilators by hand when electrical rationing shut down hospital systems. American hospitals apparently considered reliable electricity a basic requirement rather than an occasional luxury. The water systems provided another lesson in abundance that bordered on the surreal. Hot water flowed endlessly from every tap, maintained at precise temperatures through automated heating systems. American nurses washed their hands dozens of times per shift without consideration for water conservation or fuel costs. Maria had grown accustomed to washing with cold water when available, often relying on alcohol solutions when water supplies were interrupted by bombing raids or infrastructure damage. Dr. Steinberg noticed Maria's fascination with the seemingly unlimited hot water and explained the hospital's infrastructure with pride that verged on patriotic fervor. "We maintain redundant heating systems and water storage capacity to ensure sterile conditions," he said. "Infection control requires absolute reliability." The phrase absolute reliability struck Maria as representative of a fundamentally different approach to medical care, one that eliminated compromise through overwhelming resource allocation. The abundance extended to seemingly trivial items that accumulated into a portrait of systematic luxury. Fresh linens appeared daily on every bed, replaced whether soiled or not according to scheduled protocols. In German hospitals, linens had been washed and reused until they disintegrated, often shared between multiple patients due to shortages. American hospitals maintained inventories of bedding that exceeded the entire textile supplies of most German medical facilities. Food service represented another dimension of impossible plenty that transformed medical recovery from survival to comfort. American hospital meals included fresh meat, vegetables, dairy products, and desserts that provided both nutrition and morale support. Patients chose from multiple menu options based on personal preferences rather than accepting whatever basic sustenance was available. The psychological impact of patient choice in meal selection seemed almost frivolous to Maria, who had watched soldiers grateful for thin soup and stale bread. German prisoners received identical meal quality to American patients, creating daily reminders of the abundance that American society could afford to extend even to former enemies. Klaus Miller showed Maria his breakfast tray with wonder that hadn't diminished after weeks of recovery. Fresh eggs, real butter, coffee with cream, he enumerated like a child describing Christmas presents, and they ask if I want seconds. The concept of surplus food available to prisoners violated everything Maria understood about wartime resource allocation. The pharmaceutical abundance created ethical dilemmas that German nurses struggled to resolve. American hospitals stockpiled medications that expired before they could be used, requiring disposal of drugs that would have been priceless in German medical facilities. Maria watched nurses discard outdated antibiotics with the same casual indifference they showed toward used bandages. The systematic destruction of functional medications to maintain inventory freshness seemed criminally wasteful, yet medically sound. Lieutenant Chen explained American pharmaceutical protocols with the patience of someone accustomed to foreign confusion about medical abundance. Expired medications lose potency and may cause harmful reactions, she said. We maintain strict inventory rotation to ensure patient safety. The prioritization of optimal therapeutic outcomes over resource conservation represented a luxury that German medical practice had never been able to afford. But the most overwhelming aspect of American medical abundance was its casual, automatic nature. Nurses and doctors operated within systems of unlimited supply without conscious appreciation for their privilege. They had never calculated whether a patient deserved fresh bandages or rationed medications based on strategic value. They had never chosen between treating infections or saving antibiotics for more critical cases. Their medical decisions were based purely on therapeutic considerations rather than resource management. The psychological impact of witnessing such systematic abundance began affecting Maria's perception of her own wartime service. She had accepted scarcity as normal, even virtuous, believing that German efficiency made optimal use of limited resources. Now she understood that scarcity had forced her to practice substandard medicine while believing she was serving a superior cause. The abundance of American medical care exposed the lies she had told herself about the necessity of rationing patient welfare. Sister Ingrid Weber expressed the collective trauma of the German nurses in a letter that censors allowed to pass through. We thought we were practicing medicine, she wrote. We were practicing survival. The distinction between medical care and desperate improvisation became clear only in contrast to American abundance that enabled medicine as it was meant to be practiced. The endless luxury of American medical resources created a permanent change in how the German nurses understood their profession and their past service. They could never again accept scarcity as inevitable or view resource conservation as more important than patient outcomes. By December 1945, the accumulated weight of 3 months in American medical paradise had fundamentally broken Maria Hoffman's understanding of everything she had believed about medicine, war, and human dignity. The final collapse came not through dramatic revelation, but through the quiet recognition that she could never return to practicing medicine as she had before. Standing in the Walter Reed Pharmacy at dawn, surrounded by medications that represented more therapeutic power than entire German cities had possessed, Maria began to weep for the thousands of patients she had failed simply by accepting scarcity as inevitable. The tears came without warning as she prepared morning medications for her assigned ward. Each vial she touched represented lives that could have been saved, suffering that could have been prevented, dignity that could have been preserved. The morphine in her hands could have eased the final moments of soldiers who had died screaming in German field hospitals. The antibiotics on surrounding shelves could have stopped the infections that had consumed entire wards while she watched helplessly, believing that such losses were the natural cost of war. Lieutenant Chen found Maria sobbing among the pharmaceutical supplies and sat beside her on the cold linoleum floor. "It's not your fault," she said gently. "You worked with what you had." But Maria shook her head, unable to accept such easy absolution. She had believed in the system that created scarcity. She had accepted propaganda that presented shortage as strength and abundance as weakness. She had convinced herself that watching patients die from lack of basic supplies was somehow more virtuous than the American waste she now witnessed daily. The philosophical reckoning extended beyond personal guilt to fundamental questions about medical ethics and national character. If abundance could be achieved, if unlimited morphine and endless bandages were possible, then German scarcity had been a choice rather than necessity. The Reich had possessed resources for concentration camps, rocket weapons, and massive military operations while denying basic medical supplies to its own medical personnel. The priorities revealed by resource allocation exposed the moral bankruptcy of everything she had served. Sister Ingrid Weber experienced her own breakdown while observing American nurses dispose of medications that had expired by mere days. "We killed our patients to save supplies," she whispered to Maria during their evening break. "They saved their patients by wasting supplies." The inversion of values cut to the heart of their professional identity. German medical training had emphasized conservation, efficiency, and acceptable losses. American medical culture prioritized patient outcomes regardless of cost or waste. The other German nurses struggled with similar psychological transformations as they witnessed medical care practiced without compromise. Their shared trauma created bonds deeper than national identity or military allegiance. They had all participated in a system that rationalized preventable deaths as military necessity, while witnessing proof that such deaths had been avoidable choices rather than inevitable consequences. Dr. Steinberg attempted to provide perspective that might ease their psychological burden. German medical personnel did remarkable work under impossible conditions, he assured them during informal discussions. "You saved lives with resources that American doctors couldn't have managed." But his kindness couldn't alter the mathematical reality that American abundance enabled better outcomes through superior resources rather than superior skill. The final psychological blow came through letters from home, describing continued medical shortages in occupied Germany. Families reported boiling rags for bandages, using aspirin tablets cut into quarters, and watching relatives die from infections that American prisoners were recovering from routinely. The contrast between German civilian suffering and American prisoner treatment created guilt that no amount of professional recognition could assuage. Lieutenant Mills organized farewell ceremonies as the German nurses prepared for repatriation in early 1946. American medical staff presented them with supplies, small amounts by Walter Reed standards, but treasures by German measures. Bandages, medications, and instruments that would equip basic medical practices in war-torn Germany. The gifts carried symbolic weight beyond their practical value, representing acknowledgement of professional respect between former enemies. But the most valuable gift was intangible. The German nurses returned to their homeland, carrying knowledge that better medical care was possible, that abundance could be achieved, and that patient welfare need not be sacrificed to resource conservation. Some would become advocates for improved medical infrastructure. Others would struggle with depression and guilt. All would carry the memory of American medical paradise as both inspiration and torment. Maria's final entry in her private journal, written the night before departure, captured the essential tragedy of her experience. "I have seen what medical care can be when resources match need. I have witnessed healing without compromise, treatment without rationing, and dignity without scarcity. Now I must return to a world where such things remain impossible dreams, carrying the knowledge that they need not be." The German nurses who had entered Walter Reed as prisoners of war departed as witnesses to possibilities their homeland could not yet imagine. They carried with them not just medical knowledge, but proof that abundance was achievable, that waste could enable healing, and that former enemies could demonstrate mercy through superior care. The memory of American medical luxury would follow them forever, a permanent reminder of what medicine could accomplish when freed from the constraints of scarcity and compromise. If you found this story as shocking as those German nurses found American hospitals, make sure to subscribe to our channel for more untold stories from World War II that reveal the human side of history's most devastating conflict. These forgotten moments show us how war affected not just soldiers on battlefields, but the dedicated medical professionals who tried to save lives under impossible circumstances. Until next time, remember that sometimes the most powerful weapons in war aren't tanks or bombs, but simple human kindness and the abundance to care for all who suffer.